Who absorbs the consequences when waiting isn't an option? Welcome back to Healthcare in America, when care can't wait. So far, we've looked at what urgent care actually is and how systems designed for efficiency respond under pressure. In this episode, we turn to the people, the ones who carry the weight when care can't wait. Urgency does not distribute impact evenly. Some patients are more vulnerable than others. Some families are better equipped to navigate complexity, and some communities have far fewer resources. The system doesn't decide this intentionally, it just happens, quietly, invisibly, and sometimes tragically. Patients absorb uncertainty. Decisions are made with incomplete information. Recovery doesn't end at discharge, it continues at home, often with guidance that is partial, confusing, or hard to follow. Financial exposure, where it exists, is deferred but rarely avoided. Patients bear responsibility for a system that cannot fully hold them. Families become care coordinators by default. They manage transitions between facilities, interpret medical instructions under stress, and fill gaps the system cannot or will not cover. This work is essential, unpaid, and largely invisible, yet it is critical to outcomes. Frontline providers absorb moral and emotional load. Triage decisions, long hours, and high stakes judgment fall on individuals with limited authority to change the system itself. Burnout, moral injury, and fatigue are structural consequences, not personal failings. Communities absorb strain too. Rural hospitals operate with thin staffing and limited capacity. Urban safety net hospitals serve the most complex populations with the fewest resources. When one facility closes or reaches capacity, pressure is simply shifted elsewhere, often without public recognition. And yet, over time, this strain becomes normalized. Hallways fill, delays become routine, and improvisation becomes standard operating procedure. What begins as crisis quietly becomes baseline. We're not here to assign blame, propose fixes, or debate policy. Our goal is to observe and understand. By recognizing who carries the consequences, we can begin to see the human cost of urgency, the weight borne by those least able to absorb it, and often the weight that goes unnoticed entirely. In the next and final piece of this mini-series, we'll step back in the kicker to reflect on why these realities are so difficult to talk about honestly. Stay with us. Who absorbs the consequences when waiting isn't an option?